Doctors Association for Relief and Education.
I would like to invite Dr. Abdul Khaliq for his day. Please, sir, have your turn.
Time is nearing, guy. So, if any questions from all of us, we can put it forward because it should be rather than one-sided. All our speakers can join, and if any questions are there from the hall, we can take and add. Our seniors are there; they can add some words of wisdom regarding their practice. From my practice, I would like to add one or two things. When compared to other professions, our profession is gifted, wherein we can give dawat about Islam to each and every person, each and every patient who comes to us. So apart from taking history, examining and treating the patients, it is also our responsibility to speak one or two verses of Quran or one or two good words and reminding about Allah subhanahu wa ta'ala and inviting them to Islam, not only for the Muslim patients but also by presenting ourselves as very humbled and very attentive, listening and patient-friendly way, we can also create a good impression among the non-Muslim patients. So this is our core responsibility, and whenever we are dealing with each and every patient, our core thought process should be that Allah subhanahu wa ta'ala is seeing us and our main aim is to make him razi. So whenever our conversation occurs with whatever the patient it is, that should be the thing. Second thing, as all of us have seen, many of time patients will come and say, Doctor Sahab, aap jo dawa likh rahe na, isse bilkul main theek ho jana. Right? This is commonly seen once in 2 or 3 days. Many people will be coming forward and saying. Then again I say to them, देखो मेडिसिन लिखना मेरे हाथ में है और शिफा देना या ना देना अल्लाह ताला के हाथ में. आप दवा खाने से पहले आप 2 रकात नमाज पढ़िए, अल्लाह ताला से दुआ करिए और फिर बिस्मिल्लाह बोल के खाइए. So in that way, with each and every conversation that we do, so we have to always show ourselves that we are not just practicing but also showing ourselves as a good Muslims to both the Muslim patients as well as the non-Muslim patients. In the same way, others can also add their wisdoms as well as ask the questions regarding the previous topics. Regarding Dr. Hamid's, because AI is one thing which is very important, because I am also involved a bit in software. So what I can see is there are 1 or 2 things that I want to discuss from technology point of view. So as we know now, just by taking the images of the retina, there is a complete paradigm shift of looking at how a person's metabolism is there. Generally what we do, we look at BMI, blood pressure, lipid profile, looking at all other parameters, CRP, angio, etc. Just by looking at the microvasculature of the retinal images, they are giving much more information than these all parameters. And the AI has come forward in a very, very significant way. All the 3 companies, the Google, the Microsoft and the others are working on this. So in our lifetime only, we will be seeing that whatever the conventional way we were doing will be replaced by the new things. As you were saying, once the dams gates are opened, it will be flooded. In the same way, my batchmate who was in MBBS, he went and he did his PhD in computer sciences and he's at Johns Hopkins. So he is into the robotics arm of at Johns Hopkins. So they have already developed the technology wherein the robots can perform the surgeries of ENT. But for ethical reasons, they are not being given to the robots. Otherwise, there are in-house experimental robots are there wherein they perform the surgery much better than a 20 years experienced surgeon. So this technology has already developed. Initially what they did is they have put small chips on the gloves to the surgeons who were doing tonsillectomies. They got the whole way how the surgeon uses his hands. They are fed to the computers by deep learning, and it has learnt, and over a period of time, as an assistant to the surgeon, that is performing even better than a very experienced surgeon. So for other reasons, they were not given the grants to pursue that one, but this thing is not far away. So what at this juncture wherein there is a huge advances in technology, what we should be doing. So a few basics are important. During my post-graduation in PGI, during my gastro training, our whole case study was dependent upon case history taking. So your diagnosis and differential diagnosis should be done only on history taking. Examination was given very little importance. So these basics we have to learn, but also a few things like trying to auscultate and trying to find out the split of a second heart sound and these things which may not be practical after some time. So we should be taking something and leaving something, as well as we should be open to embrace the new technologies that may be coming forward in the thing. But more than this one, as Dr. Saab has said, we should be working more on developing soft skills, speaking, listening to the patients, consoling them, and transferring not just the knowledge but the wisdom that we attain from our practice to our future generations. That are a few things that I want to say, and anything else. So, any questions for the speakers? You can take over and then.